Hello, I'm Dr. Desiree Eakin from Total Illusion Aesthetic and Wellness Center, and welcome to this webinar on ExoMind. I am beyond thrilled to be able to introduce to you this latest technology in transcranial magnetic stimulation. This truly is going to be the future of mental wellness and well-being. So when we think of mental wellness, what does that actually encompass? So we're looking at things like emotional stability, your ability to adapt to change, decision-making capacity, maintaining self-control, being able to focus, motivate yourself, stress management, looking at relationships and how you're maintaining those, psychological and social well-being, as well as your ability to pursue your goals and your passion. And then looking at a feeling of calmness, that happiness, your contentment. So any disruption in any of these elements can then lead to poor mental well-being. So currently, what are our options? Well, we have several, and I feel as though none of these are islands into themselves. It really is being able to bring together multiple treatment options, multiple modalities to really get the maximum effect. So, as we all know, the go-to is unfortunately medications with antidepressants or anti-anxiolytics, depending on the condition. And then within the last few years, ketamine treatment has also become a very popular option. I think we can all agree that if there is a non-pharmaceutical option, it is worth pursuing because we have become so reliant on medications, especially in the last several years. It just seems like that is the knee-jerk reaction is here's your prescription, go ahead and go, let me know if it's not working out. Instead of really trying to get to the bottom of what's causing these emotional disturbances. So that's what's, again, so exciting about this technology. Also, other options, and usually used in conjunction, is therapy and counseling, yoga or meditation, stress management, and then mental health apps have become quite popular. And then we have our transcranial magnetic stimulation, so that TMS. So what exactly is this? For those that don't know, or even maybe you've heard of it, but not quite sure what it exactly is. So this is a non-invasive FDA-approved therapy that uses magnetic pulses to stimulate very specific areas of the brain. And these regions of the brain are those that are responsible for mood regulation, our ability to control ourselves with impulsive behaviors, and then our decision making. So to take a look deeper, what exactly are we doing with TMS? So first, let's just do a quick review of our anatomy of our brain. Very simple. The brain has four lobes, so the frontal, parietal, temporal, and occipital, and they all have their different functions. And then you have the motor cortex, cerebellum, and brainstem. So when it comes to TMS, we are going to be looking at the frontal lobe, which is responsible for that decision-making, emotional learning, short-term memory, attention, self-perception, self-control. So you see where a lot of this is underlying in those elements of mental wellness that I talked about earlier. And you can see where disruptions in any of these can lead to disorders that we commonly see. So we are going to focus on a specific part of the frontal cortex, and that's the left frontal part of the brain, so right up here on the left side. And this is referred to as the left dorsolateral prefrontal cortex, or the DLPFC. But just know, essentially, we're treating the left part of the front of the brain. And so why this is important is in today's society, in this fast-paced world that we're living in, where it feels like we're just constantly running this rat race, right? That our brains begin to shut down. It's just too much stress, too much stimulation, And so our brain, especially in that area, starts to become underactive. It dampens itself down. And this results in its diminished functions. This occurs in even otherwise healthy individuals with no underlying mental health condition or no previous history of a diagnosis of mental health condition. This is strictly from that, from just the stress of our everyday lives. So ExoMind works by reactivating this area of the brain to be able to restore the function of our cognitive function and balancing out those emotions. So it's super crucial because this part of the brain is actually the control hub. It is taking in all of the input from the inner part of the brain, and it's processing it to guide then the actions and responses. So it's ensuring that balance between logic, emotion, and action. And this gets me very excited because the research in this area is so phenomenal. I just know in years to come, we're just going to really be able to expand what we can do, especially in areas of dementia and cognitive impairment and stroke. It's just, we are on the forefront of greatness right now, and it's just super exciting to be able to be a part of it. So in our brain, we have neurons, and those neurons are responsible for sending the signals. We're going to need to be able to talk to each other to carry that information on down the line. And with disruption in the connection between the neurons, you're not going to be able to fully send the signal. So you're not going to be able to carry out, let's say if it's a movement, you're not going to be able to carry out that movement. Or that emotion, you're not going to be able to process that, or not to be able to have that memory. And so we know that we lose neuronal connections for many different reasons. One is age, just age related, we're going to lose them. Not using it, so not continuing to read or engage or be active with one another, have those relationships, any of that feedback. Without those kind of stimuli, you're going to start to lose a connection because you're going to shorten your dendrites. Or if there's been an injury to the brain, or say from a stroke or lack of oxygen or what have you, you're going to start to get those neurons to shorten. And specifically is the dendrites. These are these arms that come out from the neurons, and they then become these finger-like projections. And as they grow these finger-like projections, they're able to extend to the nearby neurons. They're thus increasing the connectivity, and the signal can be sent to more neurons. Another very important thing is, if you look at here, you'll see these blue circles, these light blue circles, and these are called synapses. And the synapses are very important because this is where your neurotransmitters lie. And neurotransmitters are our messengers. They control thoughts, emotions, movements, bodily functions. And so the more neurotransmitters you have, the healthier the cells are, and the overall healthier the brain is. And so the more dendrites, the more synapses, the more neurotransmitters. So TMS increases the release and the availability of these neurotransmitters to stimulate neural activity. Another thing to know is that we talk about growth factors from the skin. And we know that by adding growth factors to the skin, we can stimulate collagen and elastin. Well, we now have found a growth factor in the brain, and that's called BDNF. And the other great thing about TMS is that it stimulates BDNF. So the hot term to know is called neuroplasticity. And this is where a ton of research is being done right now. And if you look at the first image, these are your neurons, and then you have these long arms, which are the dendrites. But you can see in this picture that only one essentially is crossing over. And so this is what your brain looks like before ExoMind. And then as you start applying TMS to that area, you start to see where these little finger projections are starting to come out from the dendrites. And then you can see there's also an overall glow of the arms as well. And this is those synapses that are coming in there. And then after ExoMind, you can see now, okay, these dendrites from the neighboring neuron are now connecting with the other neuron. So what is so different about ExoMind? I've been saying how TMS has been around for 40 years. What makes this so new and different that gets me so excited? Well, traditional TMS, while it was very safe, absolutely effective, there were some downsides to it. One is the machines themselves, the devices were just very bulky, cumbersome, took a while to set it up, to find the area and to position it appropriately. And then the number of treatments needed were about 30. So you would have to come in 5 days a week to the office for 6 weeks, not skipping. It would have to be 6 consecutive weeks, 5 days a week. So that's a huge time commitment for somebody. Even if you're not working, it's just cumbersome also to have that much time just to come in. And the majority of patients, in some studies it's as high as over 85%, reported discomfort with any of the traditional TMS. And even patients reported that it was painful. And these treatments are also quite expensive. So if we take a look at ExoMind, and I love this picture because it reminds you of tranquility and calmness. And that's exactly what you feel when you're undergoing a treatment with this device. So this ExoTMS technology from BTL allows the patient to only need 6 treatments in a 3-week period. So you would do 2 treatments a week for a total of 6 treatments, and it's about 24 minutes of treatment time. And the most important thing is there is absolutely no pain, and there's no discomfort either. I actually find these treatments to be quite soothing and comfortable. It feels like a massage on the scalp, or like a little tingling feeling. And I am a big baby when it comes to discomfort. I'm not the no pain, no gain when it comes to myself. And I have found these very relaxing. So to go over some frequently asked questions, is ECT, that's electroconvulsive therapy, is that the same thing as TMS? And no, they are completely 2 different treatment modalities. ECT is quite invasive. It is done in the hospital under anesthesia, and the goal for treatment is you are trying to evoke a seizure. And so that's something totally different than TMS. TMS is done in the office setting. It's an in and out procedure. There is no pain. There's no need for any type of calming medication, and certainly no need for anesthesia. When I think of ECT, it reminds me of One Flew Over the Cuckoo's Nest, where you have that metal helmet that's on the head. It's kind of like the bite plate that goes in. So this is definitely not that. How many treatments? So again, it's those 6 treatments. You're doing them about every 3 to 4 days. So if you come in on a Tuesday, your next one would be Friday. Come in on a Wednesday, your next one would be Saturday. That's sort of the typical pattern that we do. Similar to if you've had Emsella treatments, it's very similar to that. And then does it hurt? No, actually patients are saying that it's comfortable and actually feels good. Who can benefit? Well, really, anyone seeking to improve their mental wellness or well-being. Even if you don't currently have any of these symptoms and you want to use it more as a preventative. I mean, this is also really, more of exercise for your brain as well, because instead of lifting weights to build your muscles, you're using magnetic stimulation to strengthen those neuronal connections. So common reasons that people have come in to and seek this treatment option are those saying, they experience brain fog or need just more of mental clarity, ability to improve their focus. Patients have also said that they've noticed their decision-making capacity has significantly improved, that prior to these treatments, they didn't realize how they were in fact having difficulty making decisions, and now they just have more mental clarity. Improvement in sleep, I would say this is pretty much everyone so far that I have treated has commented on this. I myself have also seen a big difference. In fact, after the first treatment, I had one of the best night's sleep that I had had in years. It's also really popular right now in medical weight loss for food cravings, binge eating, and impulse control. I'm using it a lot in that arena, especially as more and more people are coming off like the Ozempic or the Wegovy. The one concern is that the cravings will return, and how do I deal with those cravings? So people are seeking treatment for that. And then I have people who are currently on the weight loss medications and are using it to enhance their results that they're getting from that. Depressed mood and anxiety, this is a very common thing. Obsessive compulsive disorder, post-traumatic stress disorder, even for those who are seeking help trying to stop smoking. Stress management, absolutely. I have quite a bit of people that this is the one area that they really want to focus on. Migraines is a big one as well. And there's so much more. Currently, it's being used and studied for Alzheimer's dementia. So I'm very excited to see what the research is going to show from that. So people can also seek out this treatment if they've had a family history of dementia. They may want to do this as sort of a preventative way, or to just make sure that they're maximizing their mental capacity. So who should not have ExoMind? Well, since this is using magnetic energy, you don't want anything with metal in the treatment area. So no metal implants or stimulator devices, even cochlear implants. And those with a tendency to seize should also not have treatment with ExoMind. So essentially, if you can't go through an MRI, then you are not eligible for ExoMind. As far as side effects go, like I said, this has been used for over 40 years. Millions of people have been treated with TMS, and over 17,000 published articles. So we know that TMS is safe and effective. With the older devices, there are reports of some could get a headache or some scalp discomfort over the area where the device was placed. But the studies with ExoMind report minimal side effects, and so far I haven't had any side effects. So thank you so much for joining me at this webinar. I hope you were able to gain some valuable knowledge. Please, if you were not able to get your question answered, or you prefer to email it, please do so. I am happy to respond to all your questions, and take care.